With us now is Dr. Atwa, and we had the longest, most incredibly intense conversation about obesity, and I just wanted him to come on the television show because he's brilliant. Welcome to the show. How are you?
Thank you.
Yeah, I was so happy. We had such a good conversation, a little bit about how I grew up, how you grew up, the journeys that people have taken, and the fact that right now obesity is rampant. And because you're a specialist in that area, I wanted to have you on so that you could share with us some of your knowledge so that we can help people.
Absolutely.
What's causing the crisis right now?
There's a lot of reasons. When you look at the cause of obesity, there's a myth that if you're lazy or you don't diet, you don't exercise, you're not disciplined, that's why you're overweight. But it's not true. There's about 50 causes of obesity. The four most common, number one is genetic. So if your parents or relatives are obese, then you'll be obese also. Number two is behavioral. How do you react? Do you eat when you're stressed? Do you eat when you're sad? Do you eat when you're happy? Number three is the environment, what you're exposed to. When you go out to a restaurant, there's about 20 options. 19 of them are unhealthy. There's only maybe one or two healthy options. It's usually more expensive and it's larger portions. The last cause is medications. Certain medications like antidepressants or certain hormonal medications can cause obesity. Also, hormonal postmenopausal, women can be exposed to obesity. After delivery with the hormonal changes, that can also cause obesity. But there are a lot of factors, but the least of them is I tell patients it's not your fault that you're obese.
And not to self-shame themselves.
Yes.
I mean, because that just makes the situation so much worse. At what point should someone call a doctor or a specialist like yourself? When do they need to call and pick up and get some help?
Sure. When you're, the part that we do is a surgical part. There are different stages of obesity, just like cancer. Cancer has a stage 1, stage 2. So you want to catch any kind of disease at the early stage. And obesity is a disease. It's not a cult. It's not a religion. It's not like a way of life. So nobody wakes up and says, I want to be 100 pounds overweight.
Right.
It's a real disease, just like diabetes and cancer and high blood pressure is a disease. So look at the different levels. And according to the level, there are different treatment options. So one option is you can speak to a nutritionist. She can go over your diet, to make sure that you're eating healthy. Number two is medical weight loss, where you do certain medications or meal replacements. Number three, we do endoscopy and put a balloon in the stomach to help control your appetite. And the most successful is surgery.
Okay.
Where we go in when your BMI is more than 40 or more than 35 with a medical problem, which basically means your weight is about 80 to 100 pounds overweight.
And BMI stands for body mass index?
Yes.
It does?
It does. It's height and weight.
Okay.
So we do that and we look at the fat content of the body because you see some of the football players, they have a high BMI, but it's mostly muscle. So you have to see the different classifications of the BMI. So if your BMI does qualify you for surgery, what we do, you're seen by several doctors and then you undergo the operation. Operation is very simple, takes about half an hour, 45 minutes. We take out part of the stomach for the sleeve gastrectomy. And the reason that it works is, number one, it restricts the capacity of your stomach. So we take about 85% of your stomach out, so you're left with about 10% of the stomach. So what happens, you take a few bites, you feel that you're full.
Okay.
The part of the stomach that we take out makes a hormone called ghrelin. The ghrelin actually stimulates your appetite. So when we take it out, you're not hungry anymore.
Okay.
And that's
called a sleeve. That's
called a
kind
sleeve
of sleeve. Okay.
Yes.
So you did mention a nutritionist, and so before someone gets to the surgery or to the sleeve, you do have other alternatives for someone that might be presenting with just symptoms of mild obesity.
Yes. So the early stages, if you don't qualify for the surgery or you don't want surgery, most of our patients are seen by the nutritionist, and she goes over their diet and tries to instruct them on healthy eating, and she gives them a list of meals with the calories that they have to take every day. We also have Dr. Barr, she does our medical weight loss. So she takes a look at their medical history and decides if they're candidates for medical weight loss, which includes pills or shots or meal replacements. And in general, they lose about 10% of their body weight with that.
So one of the reasons that people want to come to you is that you offer a variety of things before surgery.
Yes.
And obesity can lead to death. It's one of the common causes of death.
When you're obese or morbidly obese, the reason it's called morbid is because it cuts your life by 10 to 12 years.
Wow.
So even though a lot of the patients look better afterwards, we're not doing this for cosmetic reasons. This is for medical reasons. When you're overweight, it increases your risk of having a stroke, heart attack, liver cirrhosis or a fatty liver. You can have reflux with the acid. You can have something called sleep apnea where you snore at night. And
I told you on the phone I have that,
yeah.
And it's bad.
So what happens when you have the extra weight, it pushes on your airway, cuts the oxygen off to your brain, so you start snoring.
Okay.
So when you wake up in the morning, instead of feeling refreshed and ready to go, you're fatigued and you're tired. When you're fatigued, it increases your ghrelin, it increases your appetite, so you eat more. And you get into a vicious cycle. It's like a catch-22. It gets worse and worse with time.
I thought you had a very interesting why when we talked on the phone about why you decided to go into this type of practice.
Yes. In general, in surgery, the main reason I went into it is because the results are rapid. Somebody has appendicitis, they have severe pain, you take them to surgery, take their appendix, and they feel great. The same with the gallbladder. You know, you have gallstones, you have pain, we take it out, you feel great the next day. With obesity, it is also this similar thing that it takes half an hour to do an operation, but it cures about 20 medical problems. It cures the high blood pressure, the diabetes. So all these medical problems are caused by being overweight. So that's the main advantage of it. Not only that, but also it increases the risk of cancer. So when somebody starts to lose weight, it cuts down on the risk of cancer.
And we also, just wrapping up, we wanted to talk about the fact that sometimes insurance doesn't cover this, and you wanted to at least bring awareness about
Yes.
all the things that this type of surgery could do that's going to help the patient.
It is. It's a crime that some insurance companies, exclude that. They say you're not allowed to have bariatric surgery. It's like almost like saying if you have cancer, we're not going to treat it, but anything else we'll treat. So it makes no sense at all. So unfortunately, they control the plans, but the majority of insurance companies do pay for the weight loss procedure because they see the return on investment. After a year or two, they're not diabetic anymore. They stop their medications. They don't have high blood pressure. They don't have high cholesterol. So they're able to save in the long run on all these medical problems.
Lovely. Thank you very much for joining
Thank you.
us. And I see that you brought this prop. So tell us, if you want to hold this, tell us what that
Sure.
is.
What this is an option for people that don't want surgery
Okay.
or don't qualify for the surgery. What we do is we do an endoscopy and we put this balloon in the stomach and it stays there for about 6 months. And what it does, it helps control your appetite. You don't feel as hungry as you were before. And in general, you lose about 20 to 40 pounds with the procedure.
Lovely.
Yeah.
Dr. Atwa, thank you so much. I'll
Thank
try
you.
not to snore tonight when I go to bed. Happy journeys to you.
Thanks a lot.
There you go. We want to bring the experts to you because we're all in this together. We're really trying hard to come together as a community and make a difference in the lives of one another. Thanks for watching.